Behavioral barriers can be overcome with the right approach. Dentists need to know how to talk to and care for patients with IDD, or intellectual and developmental disabilities. Using a tell, show, do approach is often very successful with patients with IDD. A couple of ways of doing that is using storyboards. Storyboards can use actual pictures or they can use graphics. And this is to show the order in which things are going to be done. They can be marked off with a marker when they're done, or they can be made into little cutouts. And the cutouts can be put on another board so that they're put on and either marked off or taken away as they're being done for the patient. Another option for tell, show, do is to show them a set of teeth and maybe a giant toothbrush to show them how to brush their teeth, or to show them how you would use the mirror in their mouth. And so having something for them to actually see and even maybe touch themselves. So you're going to tell them what you're going to do to their mouth. You're going to show them what you're going to do, and then you're going to do that. And that helps to kind of de-escalate the situation and help to calm them so they know what is coming. Another option is to have some kind of flashcards so that you can use those to show them what you will be doing or what is going to be happening in their mouth. Sometimes protective stabilization is necessary. When you do protective stabilization, this is not about immobilization, but being protective. And this can be a strap that maybe goes around the head, or a deep hug that goes across the body with some Velcro, or a weighted vest. But with protective stabilization, there usually is required some extra training that must be done by the dentist in dental school or residency before it can be used in the state of Tennessee. Other things that can be used to help with the patient are using devices such as the mouth props to help hold them open to make them more comfortable so they're not trying to stay open, or this type of mouth prop that is a softer one, so if they bite down, it's not so hard on their teeth. Desensitizing a patient to their dental visits prior to the visit can be very successful as well. Often you can make a kit for these patients called the desensitization kit, where they can have practice visits at home. These kits can include things like a pair of gloves and a mask and a patient bib. Caregiver can play dentist at home, and they can get adjusted to somebody putting their hands in their mouth, the taste of the gloves, the bib on their chest. You can put a mirror in there so they can practice putting the mirror in their mouth to see what that tastes like, see what that feels like. You can add saliva ejectors because the saliva ejector has a taste to it, and so they can adjust to the taste. You can put a prophy angle in there so they can touch, taste, feel. A lot of things are about touch, taste, and feel. Or put in some prophy paste so they can get adjusted to the grit. The grit is highly sensory for them, and if they can get a little bit slowly over time, they can hopefully adjust to that. Or even a bite block that's disposable so that they can get used to having something like that in their mouth. You can also have something like fidgets for them available, something like a stress ball for them to use, or a fidget spinner that they can use while they're waiting for their work to be done. Other ways you can desensitize patients is with an electric toothbrush. They can put it in their mouth with it off. They get the feel of it. Then you can turn it on and right back off. So they feel that vibration. Maybe not trying to brush their teeth with it, but they feel that vibration up against their cheek or up against their teeth. Then you do it a little bit longer for maybe 5 seconds the first time, 10 seconds the next time, so that they adjust to that vibration in their mouth. So slowly building up that time in their mouth over a time period so that they can adjust to it. And then if they can use an electric toothbrush at home, they're much more likely to be able to tolerate the prophy angle or possibly even a drill in their mouth. Having the parent practice with them at home can help make for successful visits in the office. And then as far as the techniques for stabilization go, for desensitizing, practice with your team at how to talk to the caregivers about it, how it would be done, and then actually practice doing it before the patients come in so that you're very well adapted to how that would work for you and your office. Being able to communicate with your patients, to anticipate any issues that you may have, to be able to treat them safely with whatever measures are needed, to be able to work with them and desensitizing them to get them more comfortable in their visits leads to safer visits and it leads to more dignity for the patient.